Okay, so there's the aorta. His brachiocephalic and his common carotids have been kind of torn out here, so I won't use this chart for those. But you can see the subclavian, and once the subclavian passes through the clavicle, it becomes the axillary, and then once it's in the arm, it's the brachial. The subscapular branches off of the axillary right before it gets into the arm, and it goes down by where your scapula is, so that's the subscapular. Over here, subclavian turns into the axillary, turns into the brachial, then it branches off into the radial and the ulnar, and then the palmar arch in the palm. Internal thoracic is here. It's a long skinny one going down on both sides of the sternum. This one only has it here on the left, but it would be also on the right. The intercostals, did you get that?
Yeah.
The internal thoracic is right there. The intercostals are between the ribs, so that would be the anterior intercostals right there. Here, this is the aorta going down. These long skinny ones are the gonadal arteries. And then at the bottom of the aorta, it branches into the common iliac arteries, and then the common iliacs branch into these two, which are the external iliac and the internal iliac. And if you follow the external iliac down into the leg, it becomes the femoral artery, and it branches off into the deep femoral artery. And then as it goes behind the knee, which you can see over here, which is a back view of the knee, it becomes the popliteal. For the lower legs, I don't like them on this chart or on the other chart either, and the book is also actually labeled incorrectly, so don't look at the book for the lower legs, use only APR for the lower legs. For this section over here, there's the aorta. This number 27 would be the celiac trunk, and then the gastric arteries make this circle, so number 28 would be the left gastric artery, where number 31 would be the right gastric artery. Number 36 would be the common hepatic or the hepatic artery proper. 32 is a gastroduodenal. You can sort of see it like a ghost vision through there. The splenic also, it's behind the stomach, so it's sort of that ghost view of it right there. And then the gastroepiploics, left gastroepiploic around the outside, and right gastroepiploic on like the bottom on the right side. And then these go into the intestines. This number 48 is the superior mesenteric going down, so it's kind of big, and it has three branches: the middle colic, the right colic, and the ileocolic. And the initials for those are MRI, so you can remember what order they go in. So middle colic, right colic, ileocolic. And then here, this is the inferior mesenteric, and it branches into the left colic going up and the superior rectal going down towards the rectum. Okay, so that's it.